Policy and Politics in Nursing and Healthcare, Book Review. Summary. Policymaking and the role of nurses in changing political decisions are the key components that are described in the book Policy and Politics in Nursing and Healthcare. The major purpose of the paper is to provide a summary of the chapters and to highlight the pivotal ideas that are presented in the work. Political Ideology and Philosophy. The book provides a deeper understanding of the connection between the occupations of nurses and ideological and political concepts. Being aware of the philosophical and political themes, the nurses will be able to develop better work strategies and perspectives. The authors note the role of political philosophy and ideology in the issues concerning gender and race. The authors highlight the question of individuals and states and present the major ideas described by Thomas Hobbes, John Locke, and Jeremy Bentham. Hobbes focused his attention on the significance of the role of the government in the life of society. The philosopher claims that the community would live in chaos without governance. The theory can also be applied to the nursing practice, as the government should intervene in the healthcare system to prevent unlicensed practices that harm the clients. In contrast, Locke is sure that individual rights should receive priority, and the community requires little governance from the state. Bentham notes that sometimes the rights of individuals are contradicted, and that is why the government should interfere. For example, some people have the right to smoke, whereas others have the right to fresh air. Then the authors focus on the different types of political ideologies, namely liberalism, conservatism, and socialism. The accent is made on discovering the major representatives of the philosophers and pivotal objectives that describe each type of political ideology. The policymaking process. The conceptual models of the presented policymaking provide better involvement of the nurses in the changing of the system. First and foremost, it should be stated that health policy encompasses the political, economic, social, cultural, and social determinants of individuals and populations and attempts to address the broader issues in healthcare. The authors provide a bright example that shows how the theory should work in practice. In case the medical setting lacks nurses and patients have to wait a long time to receive care, the nurses should react to the issue appropriately, namely by working more hours to improve the condition. The authors move on to the peculiarities of policymaking in the United States. It should be stressed that the sphere of healthcare faces challenges. On the financial side, the system is complicated as it is decentralized. The problems in the state and federal cooperation influence healthcare delivery. It was informative to get a better understanding of two models of the policy process, namely the longest policy cycle model and Kingdon's policy streams model. The major aim of nurses is to improve the healthcare system, and that is, they should take an active part in changing the policies and influencing the reformation process. Care transition and the role of the research. It is significant to understand the question regarding the care transition better. The authors provide an in-depth analysis of the modern system of the care transition and highlight that inadequate management can cost an impressive amount of money. However, one should keep in mind that such difficulties can be eliminated using research as the major tool in shaping political and policy decisions. Policymaking and the children's health care. One of the biggest accents is laid upon the problem connected to policymaking and research for the improvement of children's health care. The policymakers who deal with children notice that underperformance and cost issues have become significant problems in medicine. According to recent research, several fundamental elements influence the development of the brain, among them are poverty, discrimination, and adverse events. The stated problem will affect the child's development and will have an impressive influence on future performance. Numerous researches and findings discovered the fact that almost 20% of children have mental problems in the United States. It influences their school success and relationship with the community. One of the possible solutions described in the book is to increase the awareness of the public regarding mental disorders, monitor the risk factors, and develop new treatment programs that will contribute to the best outcome. The researchers highlighted the need to change the policy of the children's healthcare system. However, there are not enough possibilities to check whether all children live in good conditions, do not suffer from racial discrimination, and have access to high-quality medicine. the amount of money spent on the development of children's programs is considerably low in comparison to adults and disabled. However, it should be noted that nurses are responsible for professional service delivery and have a significant impact on public opinion. The nurses should provide the necessary information regarding the mental problems in children, join the groups, and change the policy.